This video is about capillary blood sampling in the newborn. Capillary blood sampling is the most common and preferred route to obtain blood in the newborn period. Capillary heel sampling, more specifically, is an easily mastered, minimally invasive technique that provides laboratory data similar to venous and arterial samples. Capillary heel sampling preserves those precious veins and arteries for future reference if intravenous or intra-arterial access is required. Limitations of capillary blood sampling are encountered when blood cultures are required, coagulation studies are required, the volume of blood exceeds 1.5 mLs, or when minimal amounts of hemolysis will alter the validity of the laboratory value being assessed. The equipment required for capillary blood sampling is as follows. A heel warmer is utilized to promote vasodilatation and increase the blood supply to the region. Chloroprep, betadine, or alcohol swabs are typically used to cleanse the area prior to lancing the heel. The agent utilized will depend upon the institutional guidelines. Appropriate blood collection microtainers or capillary blood tubing. A piece of gauze is used to wipe away the initial drop of blood and to tamponade the hemorrhage when the sampling is complete. A pacifier and sucrose solution for pain control measures. An automated heel lancet. The type of lancet is selected based upon the size of the infant and the subcutaneous tissue that must be penetrated. The micropreemie tenderfoot lancet is used for those infants less than 1,000 grams. The preemie tenderfoot lancet is used for those infants greater than 1,000 grams. The newborn tenderfoot lancet is typically used for those infants that are term through the first 6 months of life. Each lancet varies in the length and depth of the incision created. The infant's identity was assessed by utilizing 2 of the approved JACO identifiers, and the blood sampling necessity was confirmed with the medical provider. A heel warmer was in position for 5 minutes, and oral sucrose was administered for 2 minutes prior to initiating this video recording. A heel warmer is being utilized for visual confirmation of the appropriate application. The preferred area for capillary sampling is the outer aspect of the heel. Do not use the end of the heel. The calcaneum is superficial at this site, and there is an increased risk for the development of osteomyelitis. An alcohol swab is being utilized to cleanse the future puncture site and the surrounding tissue. The appropriately sized tenderfoot lancet is being used to puncture the heel. The first drop of blood is wiped away with a piece of gauze. Subsequent blood will be collected for sampling. Please note that the infant is swaddled and additional sucrose is administered intermittently for continuous pain control. Notice the hand positioning. The fingers are along the calf and the thumb stabilizes the ball of the foot. Pressure is applied to the calf in a direction towards the heel. Free-flowing blood is collected in a microtainer. When the blood flow ceases, calf pressure is released, the capillaries are allowed to refill, and the process is repeated. Do not squeeze the heel. Squeezing the heel results in greater pain, lower blood yield, and increased cell lysis. If the bleeding stops, Wipe the site with gauze to disrupt the clot formation. If the blood still does not flow freely, choose another site and repeat the procedure. Be certain not to scrape the heel with the microtainer. This will cause hemolysis and lead to inaccurate lab results. Once again, pressure is applied to the calf in a direction towards the heel. Free-flowing blood is collected in the microtainer. When that blood flow ceases, calf pressure is released, the capillaries are allowed to refill, and the process is repeated. When the capillary sampling is complete, tamponade the puncture site and wrap with gauze or an adhesive bandage.